Hi, Fiona.
Hi, Prem.
How are you doing?
Very well, thank you.
Thank you so much for agreeing to speak to me. This conference for me personally has been an amazing eye-opener. And hearing you speak this morning was, for me, it was a big eye-opener.
Yeah.
I come from Malaysia. And in our part of the world, addiction treatment in itself is still not very advanced yet.
Yes.
It took us a long while to understand that addiction is a disease. It needs to be treated.
Yes.
And now we're trying to introduce harm reduction as another form of a treatment methodology, right?
Yeah.
It's been difficult. It's been very difficult. And I thought, we'd love to hear your views on the amazing work you've done back home.
Look, it is difficult because I think still that kind of Nancy Reagan just say no approach still permeates.
Yeah.
And we think that people just should be strong. They should, I don't use drugs. Why should they use drugs? And we don't, now that we understand that it is a disease, that it is an illness, that we understand very often it's based in childhood trauma or even intergenerational trauma. Now we understand that. The next step is how do we keep someone alive until they're ready to go into recovery? And that's where, in my mind, that's where harm reduction comes in. And so it's not easy to advocate for it, but once harm reduction measures are in place, people obviously see the wonderful benefits of that. So whether that's seatbelts in cars,
right,
or condoms during sex, or needle exchanges, or supervised injecting rooms, or decriminalisation.
Right.
These are all aspects of trying to reduce the harm on a person, and that does reduce the harm on our society.
Right. I work in addictions, right? That's my core work. I work with people with substance, alcohol, drug addiction, or gambling addiction, any kind of addictions. And we have always thought, like I said, it was difficult to move from thinking this is a lack of willpower to, this is an illness.
Yes.
And now we are saying abstinence is not the best treatment model.
No.
We have to look at a sustainable recovery, harm reduction approach, right? And with the policymakers, it has been a challenge.
Yes.
Because that is the biggest thing, the way we still use the death penalty.
Yes. Yes.
So can you tell us what were some of the challenges you faced and how did you overcome them from a policymaker's perspective?
Look, it's exactly, we're very close nations geographically, but I think some of our cultures are quite different. And we don't have the death penalty anymore anyway. We did have it. It's, again, as I say, it's still, we still struggle with it. We still struggle. So when I was arguing for a supervised injecting room, now everyone understood the science and they understood the evidence, and they could see that in this one small 300 square metre area, people were dying every week from an overdose. And we knew that we could save them. But for people to be brave enough, for policymakers and politicians to be brave to say, you know what, we might hate that they use heroin, we might hate that they use methamphetamine, but we want to keep them alive. And that's actually the most probably the most disappointing thing is that sometimes people don't care whether they live or die. Those lives don't matter. But when we present, so when we were arguing this, we presented it with the mothers, with the sisters, with the sons and the daughters, and presented the humanity of that person. And then you started to see sympathy, then you started to see an understanding that this could be your brother, this could be your sister, your daughter, and we could see change. So, putting a human face to substance use, I think, has been a benefit for us in Australia.
Okay, that helps. Now, as I was saying earlier, we have moved quite a bit now. In fact, talking about the death penalty, now, just the last couple of months, we are reviewing the laws.
I heard this. It's very good news. I think, and I think, laws are actually part of the problem. Right. It's really hard for someone to seek help when they face severe penalties for their substance use. Exactly. So this is a real issue, and it's something that I'm campaigning at the moment for, is to decriminalise the use of drugs, so that if people do need to seek help, we can talk to them more easily about that, and we can try and reduce that stigma. And we've been hearing here that even the stigma of smoking is something that actually prevents people from giving up smoking, because they feel so terrible about being a smoker that they don't look after themselves and they keep smoking. And with changes to laws, that's other ways so that we can reduce the harm of those drugs, because sending someone to prison does not help with their addiction. Yeah.
2/3 of people in prisons apparently have drug-related offences, right? And they come out, they repeat, they relapse, the offences repeated, they go back in again.
That's right.
And we're not treating the disease, we're just punishing them over and over.
That's right.
The crimes they commit.
That's right. In Victoria, in my state, 15%, so nearly 20% of all of the cases that go through our courts are for the use and possession of drugs. There you go. Not for trafficking, not for manufacturing, just for using and possessing. So, it's a waste of the taxpayers' money, and it doesn't help those people.
Yeah, it doesn't. They need to be treated, right?
That's right. And look, I think it's probably worth acknowledging that people, some people use substances and don't have an addiction.
Yeah, that's true.
Whether that's alcohol or other substances. But it's it's hard for those that do have a problem to seek that help when we criminalise those drugs and make it difficult for people to access treatment. And when we're spending our money sending someone to prison instead of spending our money on rehabilitation, on counselling, on education.
Exactly. I was thinking of what you said earlier, which put a human touch to it, right? Put a human face to it, and this is something that we're not doing enough. I think, not only where I come from, but I think in most countries we're not doing enough of that because the policymakers don't see that.
That's right. Right. And you as a specialist see that. So you think of what the politician's idea of someone who is addicted, and they think it's someone in the streets wearing rags, stealing. And quite often it's not. Yeah. It's actually someone who's holding down a job, has a family, but is putting themselves at risk. Yeah.
And in fact, now, the treatment, the type of substances that are being abused is changing. You're right. Not only, I'm from the treatment industry, right? So we don't see people who are on the streets. We see professionals. Yeah. We see proper, responsible people who have families and who have jobs. But they have this illness. Yeah. And very often they do not seek help, as you rightfully said, because the law punishes them. Yeah. So they have this fear. If I come and ask for help, I'm going to go to jail, I'll lose my practice.
That's right. So I think it is really important for us to, as we advocate for different treatments and things like that, that we also advocate for changes in the laws to make those treatments more accessible, to educate people. And certainly, and we all look at Portugal as a model, and it's a good one. Yeah. They've now had over 20 years of analysis to show us that they didn't see an increase in drug use. They didn't see an increase in crime. In fact, what they saw was a decrease in drug deaths and a decrease in the number of young people using substances.
I think that's because now they know they can come and ask for help. Because as you said, not everyone becomes addicted.
That's right.
Not everyone who drinks alcohol becomes an alcoholic.
That's right.
There's a small percentage for various reasons, right? Biological reasons, predisposition, psychological reasons, trauma. Yeah. So not everyone does, and that small population need to be treated as well.
And when you think about the legal drugs, and I think tobacco is a good example given where we are today, But when we look at tobacco, we've been very successful in running campaigns to reduce tobacco use in a lot of countries, and certainly Malaysia is no different. Your numbers are going down, but that's because it's legal, and that's because we can control it, we can regulate it, we can say where it's sold, who it's sold to, and how it's sold. We can't do that with illicit drugs. We can't ensure that that young people. Drug dealers don't ask for age verification. So once we regulate a market, we can control it much more easily, and we can help with ensuring that we can reduce the harm or minimize the harm that's caused, and then we start looking at other harm reduction tools.
Like we did that very successfully with opioid addictions, right? The methadone program, needle exchange program, which brought down HIV, and
that's right,
which was very successful. Sadly, we haven't found a replacement for methamphetamines, or we haven't found a substitute yet. So possibly harm reduction could be a very good way to start moving forward, I would think.
That's exactly right, and enabling people to seek that help. And we know, with methamphetamine, it is a very different addiction model to opioid addiction, and what we're seeing is that kind of replacement therapy will be different for methamphetamine. And you're right, there will be other harm reduction methods that will assist in keeping those people safe. And I think it makes complete sense when we look at Switzerland and we look at Canada, where they give heroin to people who are addicted to heroin, and that completely breaks the nexus between crime. It reduces crime because people are no longer breaking into cars or stealing to support their habit. Do we look at something like that with methamphetamine, that we look at supplying some form of analog or something similar, so we can at least break people out of the criminal connection, but then also start having them in a room with someone who cares whether they live or die, and someone who can start them talking about the process of why they're using at harmful levels.
This question, I'm thinking as we're speaking right now. You are with you're a policymaker, You're with the parliament, and you're a member of the parliament. Now, what would you need to, let's say if you are not involved in this harm reduction, right? And I'm coming to you, and I need your support. What would I need to do to gain your support as a member of parliament?
I think personal stories help. Putting a face to the problem really helps. And I think, and politicians, they're there because of people electing them. So they're only there because of people. So I think presenting the personalising something, because politics is always personal, is important. Data is important. It's important for politicians to have confidence that the policy change will be successful. And when we're talking about drugs and illicit substances, quite often it's about the lawmakers. And I find this in the work that I do is I have to bring the police along with me, and sometimes, and that's not hard. The police see they're there. They see the consequences of some of the laws. They understand that they don't want to be knocking on someone's door to tell that parent or that husband that their loved one has died. So I think police are important in this, and I encourage harm reduction advocates to talk to police.
Okay, all right, that makes a lot of sense. Okay, thank you very much. So put a face to it. Data. get the police involved.
Yes, I know that last one. That's the hardest one. But I certainly think, politics is personal. So when people understand, it could be their sister, it could be their son.
Everything is personal, actually, isn't it? Yeah, even the war becomes personal, right?
Of course.
Yeah,
of course. That's right.
Okay. Now, thank you so much again, and also we are so looking forward to seeing you in Malaysia next month in July. The conference is themed Evolving Treatment Methodologies in Addictions, ETMA, ETMA, and we're going to be talking a lot about sustainable recovery and harm reduction. I think with your experience, your amazing background as a member of the Parliament and as an MP, it's going to be very helpful for all of us to hear. We're so looking forward to this.
Well, and I know I will learn a lot because I've looked at some of the people that are attending, and they really are experts in the field. Yeah. So it will be a very interesting conference. Thank you.
Thank you again. Thank you so much, Fiona.
Thank you, Prem.